Oh my, that is beautiful. Are you all right?
Push it. Got it. Faster.
Before a stroke strikes, your body often sends out clear warning signs. The problem is, most people miss them. It might be a sudden episode of dizziness, numbness in one arm or leg, slurred speech, loss of balance, or simply persistent fatigue with no clear cause. If you're living with high blood pressure, have a history of heart attack, or are under chronic stress, these subtle symptoms could be the early warnings of a major stroke. Watch this video carefully to uncover the 10 silent signs that often appear 7 to 30 days before a stroke, and more importantly, what you must do now to prevent serious consequences. Did you know your body often gives warning signs weeks or even days before a heart attack? Yet most people ignore them. The most dangerous part of a heart attack isn't the sharp chest pain. It's the quiet feeling that everything seems fine. If you're living with high blood pressure, have had a previous heart attack, or are under constant stress, those small signs may be your body's early alert of an impending cardiac event. Every 40 seconds, someone in the US has a heart attack, and many of them have no idea it is coming. A heart attack is a medical emergency because the blood your heart is pumping fails to reach part of your brain. That part is starved of oxygen and nutrients, killing thousands of brain cells every second. For some reason, cardiovascular diseases are rising rapidly across the globe, especially among younger adults. Many early symptoms are subtle and easily mistaken for everyday issues like stress, indigestion, or poor sleep. The most important thing is knowing how to recognize them. If you experience any of the signs shown in this video, don't wait. See a doctor immediately, because they could be the only warning you'll get before a serious heart event. Watch until the end, because what you learn today might save your life or the life of someone you love tomorrow. In this video, you'll discover 10 silent warning signs that your heart may be in danger, from unusual fatigue and cold sweats to a sense of unexplained anxiety. These seemingly small symptoms could be your body's final cry for help. First sign, persistently high blood pressure. If your blood pressure is not well controlled, it can greatly increase the risk of a stroke. Blood pressure, the force of blood against the walls of our arteries. If this pressure is high, it is called high blood pressure. This high pressure can damage blood vessels, and over time, it can cause them to become narrower, weaker, and even rupture. If a blood vessel in the brain ruptures due to high blood pressure, bleeding can occur, resulting in a hemorrhagic stroke. If high blood pressure damages the arteries that supply blood to your brain, it can reduce blood flow and blockage and lead to an ischemic stroke. That's how important it is to know if you are hypertensive and, if you are, to treat it appropriately. Make a lifestyle change and take your medications correctly to control your blood pressure. This is essential to reduce the risk of stroke and other cardiovascular diseases. Second sign, excessive fatigue. Excessive fatigue or extreme tiredness can be a symptom or warning sign before a stroke. Remember that fatigue can also have other causes. The fatigue related to a potential stroke is often intense and causes persistent tiredness, which may be atypical for you and is unrelated to physical exertion or lack of sleep. For example, excessive tiredness may be related to changes in blood flow to the brain. It could be caused by a narrowing of an artery due to atherosclerosis or a possible clot that interferes with the supply of oxygen. So, if you are feeling unusually tired, see a doctor to be well evaluated. Third sign, transient ischemic attack TIA or mini stroke. Sometimes, what feels like a temporary spell could actually be a transient ischemic attack, often called a mini stroke. A TIA produces stroke-like symptoms, but they are temporary, usually lasting only a few minutes to a few hours, and then resolving completely without causing permanent brain damage. This happens because the blood flow to a part of the brain is briefly blocked or reduced. While the symptoms might disappear, a TIA is a major warning sign. It's a medical emergency because it strongly indicates that a full, more damaging stroke could happen soon, sometimes within days or weeks. Never ignore TIA symptoms just because they go away. Seek immediate medical attention by calling 911. Fourth sign, vision problems. If you have any sudden vision changes, it could be a warning sign of a stroke. Blurred vision, double vision, problems with one eye, or difficulty focusing may also be signs of brain circulatory damage. When vision loss occurs, it may be due to a blockage in one of the arteries that supply blood to the eye. Of course, there are other causes of vision problems. Even so, don't stop investigating what is happening. Fifth sign, numbness or weakness in the extremities. Numbness or weakness in the extremities, especially on one side of the body, can be a warning sign before a stroke. This sudden numbness or weakness usually occurs in one part of the body, such as the arm or leg, or one side of the face. One side of the body may lose sensation. These symptoms usually only last a few minutes or hours, but they should never be ignored. Even if it is not a stroke, it could be a neurological problem that should always be investigated. Sixth sign, sudden dizziness, severe loss of balance, or lack of coordination. Pay close attention to any sudden onset of dizziness that feels like the room is spinning vertigo, or a sudden, unexplained loss of balance or coordination. You might find yourself stumbling, unable to walk straight, or having trouble with simple coordinated movements you normally do without thinking. While these can have other causes, if they appear abruptly, especially with other potential stroke symptoms, they warrant immediate medical evaluation. This is different from general lightheadedness and can be a sign that a part of the brain controlling balance and coordination, like the cerebellum, is affected. Seventh sign, speech problems aphasia. A person who is about to have a stroke may have sudden difficulty speaking. The speech may be slurred dysarthria, and the person may have trouble saying the words or forming complete sentences. This difficulty in understanding, formulating, or expressing speech is called aphasia. Eighth sign, sudden confusion or trouble understanding speech. Beyond just having trouble producing words, a critical warning sign is a sudden state of confusion or an abrupt difficulty in understanding what others are saying. The person might seem disoriented, unable to follow simple instructions, or struggle to grasp conversations they would normally understand. This isn't just forgetfulness, it's a sharp, noticeable change in their ability to process information or comprehend language. This can be a sign that the language centers or cognitive processing areas of the brain are being affected. Ninth sign, sudden and intense headache. A sudden, severe headache may precede a stroke. It is important to note that not all headaches are related to strokes, and not all strokes are preceded by a headache. In an ischemic stroke, a headache can occur due to the obstruction of blood flow to the brain. These pains, when they occur, are often described as severe and sudden. In a hemorrhagic stroke, which occurs when there is bleeding in the brain, the headaches are also intense and occur due to the bleeding. This type of headache is often described as the worst headache of my life. Sometimes, a severe headache can be a sign that an aneurysm is about to rupture in the brain. This is another thing to always keep an eye on. 10 sign, other neurological symptoms. A person who is about to have a stroke, whether hemorrhagic or ischemic, may have other neurological symptoms. Sudden memory problems, unexplained nausea, or vomiting may also be earlier indicators. In other words, they may appear a few days or weeks before a significant brain event. However, several other conditions can also cause similar symptoms, such as seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system. So, always look for a good doctor to be well evaluated. Now you know that interrupted blood flow can put you one step away from suffering a stroke. Other risk factors that can cause a stroke are alcohol and drug abuse, obesity, an unhealthy diet, depression, anxiety, and a sedentary lifestyle. All these factors trigger specific processes in your body that can result in a stroke. In fact, strokes don't always show any symptoms before they happen. That's why prevention is essential. Control your blood pressure. Maintain your blood glucose levels normally. Exercise regularly for at least 150 minutes a week. Simple walking is very beneficial. Eat fresh, healthy foods. Avoid processed foods, sugar, and excessive saturated fat. Control your cholesterol, and keep your checkups up to date with your doctor, including your cardiologist. These actions will help prevent you from having a possible stroke in the future. Remember, managing known risk factors like high blood pressure, diabetes, and quitting smoking are some of the most powerful steps you can take. If you found this video helpful, don't forget to like and subscribe to the channel. You can also encourage others to take care of their brain health by sharing this video. Most importantly, if you or someone you know experiences any of these sudden symptoms, don't wait. Call 911 immediately. When it comes to strokes, time is critical. See you next time.